Hi friends, this is Dr. Anish Waknali. Today let's talk about ADHD. What is ADHD and how do you identify whether you have ADHD or whether your child has ADHD? So ADHD is seen both in children as well as in adults. To start off with, let's start with children. So normally parents whose kids have ADHD, they will complain that the child is not sitting too long, is not focusing too long, is hyperactive, physically hyper, like running around from one place to another place. They don't tend to take commands very easily and do not follow them. A lot of times they may be fearless, okay? There's no fear. So you have to be super strict with them, for example, to even make them sit. They can be very impulsive and may lack a lot of patience, okay? So if you tell them to sit for too long, or even like, for example, when you go out, and you tell them to wait for the elevator to come or the lift to come or for their turn, they will not wait. They will be very impulsive and very impatient. They would want to do things very quickly, okay? And their reactions could be very sudden. That's what impulsivity means. Children at home will, tend to be roving around, running around all the time. They won't be sitting and doing what's being told to them. They can be sometimes destructive. They could have social issues where they would not play games appropriately, not wait for their turn, could be dominating. In school, we normally see children to have complaints where again they don't sit, don't finish their homework. A lot of kids are not able to write and read. You see, for writing, you need to focus, okay? And you need to be patient. Children generally with ADHD will have issues with writing. They can be very, disorganized. They would not know where their books are, where their pens are, etc. Okay, so this is in short what children would look like in ADHD. Whereas as this child grows up, and becomes an adult, or purely cases where we see ADHD in adults, you may not see physical hyperactivity. However, you will see them to be disorganized, can't plan things into the future, procrastinating, will not do things timely, will not stay to their commitments, will get bored, will change jobs very quickly, will be tuned off. In short, basically you're talking to them and their mind is somewhere else. So children and adults may present things a little differently. I hope you are able to identify if you have ADHD and seek treatment. Thank you.